Okay, spinal nerves. Hang in there, guys. Hang in there. Okay, so spinal nerves. The spinal cord has 31 spinal cord segments. The 31 spinal cord segments have 31 spinal nerves from C1 to coccyx 1 associated with them. Spinal nerves are bundles of axons that enter/exit the spinal cord. They're mixed nerves, so axons are entering the spinal cord and exiting the spinal cord. That's why I say enter/exit the spinal cord. Okay, so the spinal nerves enter/exit the vertebral column superior to the C1 vertebrae and then inferior to each vertebrae from below C1 onward. However, the way that the spinal nerves are counted in just the cervical part of the spinal cord and vertebral column, it's counted that C1 is above the first vertebrae, then C2 is below, C3 below, C4 below, C5, C6, C7, C8. So you actually end up with 8 cervical spinal nerves, even though there are only 7 cervical vertebrae, because the one is above and then the rest are numbered 2, 3, 4, 5, 6, 7, 8. Okay. They could have called the first one like C0 and then kept up the numbering system that's used in the rest of the spinal cord, but they didn't. What can we do? The spinal nerves exit the vertebral column through intervertebral foramen, a structure that you have learned. The intervertebral foramen are lateral passageways formed by the meeting of a superior and inferior vertebrae. You cannot have an intervertebral foramen without 2 vertebrae. Okay, the spinal nerves are a mixed bundle of sensory axons that enter the spinal cord and motor axons that leave the spinal cord. See in the picture, the sensory neurons are shown in blue and the motor neurons are shown in red. The sensory neurons are incoming and the motor neurons are outgoing. Dorsal or posterior roots contain only sensory neuron axons. Ventral or anterior roots contain only motor neuron axons. Now, they are called dorsal roots and ventral roots more commonly. So please learn the words dorsal roots and ventral roots. All right, and shown here in this picture where we have a dorsal root, which would be full of just sensory neurons, and a ventral root that would be full of just motor neuron axons. Sensory neurons are pseudounipolar neurons. Their cell bodies are in dorsal root ganglion located just lateral to the spinal cord. Their axons continue into the spinal cord in the dorsal or posterior roots. So here we get to see that pseudounipolar neuron structure that we learned in the last lecture. It doesn't go to waste. We see that coming from the periphery, there's an axon, and then it's going, and then it passes the cell body of the neuron and continues onwards as the axon again, and then that is what enters the spinal cord. The motor neurons are multipolar neurons with their cell bodies in the spinal cord, and the axons of the motor neurons exit the spinal cord through ventral or anterior roots. The dorsal and ventral roots of the spinal nerves are located in the vertebral canal, and the dorsal root ganglia and spinal nerves themselves are located in the intervertebral foramen. Just to give you an idea of where these structures are in relation to the vertebral column. The spinal cord and the vertebral column grow at the same pace until we are age 4. The spinal cord segments, dorsal and ventral roots, dorsal root ganglia, spinal nerves, and intervertebral foramen are all perfectly aligned with each other transversely until the age of 4. After the age of 4, the spinal cord stops growing and the vertebral column keeps growing in an inferior direction. In an adult, the result is that the lumbar spinal cord segments L1 through L5 remain up at the level of the thorax T9 to T11 vertebrae. So kind of stranded up. The S1 to coccygeal 1 spinal cord segments remain up at the level of T12 to L1 vertebrae, and the whole spinal cord ends by the L1 vertebra. The dorsal and ventral roots, dorsal root ganglia, and spinal nerves from L1 to coccygeal 1 spinal cord segments are stretched inferiorly by the growth of the vertebral column. They hang down in the cauda equina or horsetail. The L1 to coccygeal 1 spinal nerves pass through the original associated intervertebral foramen and in the sacrum, the original associated sacral foramina. Kind of crazy, right? Spinal nerve, connective tissue. Spinal nerves are surrounded by epineurium, a dense, irregular connective tissue sheath that is continuous with the dura mater of the spinal cord. Perineurium surrounds a fascicle or a bundle of axons within the nerve. It protects axons from blood and interstitial fluid. Endoneurium is composed of loose connective tissue that surrounds each axon and its associated Schwann cells. The endoneurium contains capillaries that bring oxygen and nutrients to the axon and cells. And I don't think any of this is a surprise because we already learned about just plain old nerves and their connective tissue surrounding layers in the last lecture. The only thing special about these are that they're surrounding a spinal nerve instead of just any old peripheral. Okay, spinal nerve rami, dorsal and ventral. Spinal nerve rami are spinal nerve branches. Spinal nerves extend for only a short distance after they leave the intervertebral foramen. Just beyond the foramen, they split into a dorsal ramus or posterior branch and a ventral ramus or anterior branch. The dorsal rami supply the posterior of the body. The ventral rami supply the lateral and anterior body and limbs. And if we look here, the cutaneous distribution of the dorsal rami is shown in green. So we see there that the dorsal rami are supplying the posterior of the body or innervating the posterior of the body. And here's just a picture of dorsal and ventral rami that really helps you to understand that the dorsal rami are branching off from the spinal nerve and they are going posterior. They're going posterior, and the ventral rami are going anterior. These pictures are pretty great, so I'm glad I found them. The dorsal and ventral rami contain both incoming sensory axons and outgoing motor axons. So using our same blue is for sensory and red is for motor, we see that there are incoming sensory axons that are just going to, go to the dorsal root ganglion if they're coming from the dorsal ramus, but if they're coming from the ventral ramus, those sensory neuron axons are going to, split off and go towards the dorsal root ganglion and the dorsal root. And the same thing for the outgoing motor neurons. Some of them are going to go and split off and go into the dorsal ramus, and some are going to go and split off into the ventral ramus. The sensory information in rami, so the dorsal rami, the ventral rami, comes from somatic, visceral, and special sensory receptors. So there's a little review. What the heck are somatic sensory receptors? Well, they monitor the skin, joints, and skeletal muscle for pain, touch, pressure, temperature, and visceral sensory receptors monitor, in this case, cardiovascular systems, and special sensory receptors, in this case, monitor balance. The motor commands in rami go to skeletal muscles, smooth muscles, and glands. So the rami are not exclusive in any way. They have incoming sensory axons and outgoing motor axons, and they have incoming sensory information from somatic, visceral, and special sensory receptors, and they have outgoing motor commands to skeletal muscles, smooth muscles and glands. So there's a lot going on in the dorsal and ventral rami. The pictures in Martini's are extremely complicated, so I did my best to find other pictures that would give you a sense of dorsal and ventral rami, their location, structure, and function. Okay, spinal nerve dermatomes. A dermatome is a segment of skin that sends sensory information to a spinal nerve and spinal cord segment. The sensory information enters the dorsal and ventral rami and then the spinal nerve. There is some overlap between adjacent segments of skin. So even though it's drawn here as though the dermatomes were extremely sharp at their edges, sharply separated at their edges, that's not accurate. Okay, clinical correlation coming up. Okay, shingles. Varicella zoster virus is an infection with a virus that causes chickenpox, often in childhood. It's followed by a lifelong latent varicella zoster virus infection in a dorsal root ganglion. For some reason that is not well understood, the virus can be reactivated. The virus then travels from the dorsal root ganglion down the sensory nerve axons to the skin of the associated dermatome. In the skin, it causes a painful blistering rash, and there's a picture of a fellow with a painful blistering rash there. Luckily, there are now vaccines against varicella zoster virus and shingles. They give you a little booster after the age of 50 or so that your varicella zoster virus doesn't reactivate and you don't get this painful blistering rash called shingles. Okay, plexuses, and plexuses is the last part of the lecture, but again, keep going, guys. You could do it. Okay. The spinal nerve plexus or aspinal nerve plexus is an interwoven network of the ventral rami of spinal nerves. I will say that again. A spinal nerve plexus is an interwoven network of the ventral rami of spinal nerves. The plexuses combine the axons in different rami to form peripheral nerves. So close to the spinal cord, the different rami come out from the spinal nerves, and then they tangle up into plexuses. The fibers are then mixed together, and the fibers mixed together form peripheral nerves. The nerves carry both sensory and motor impulses. The dorsal rami do not contribute to spinal nerve plexuses. There are 4 spinal nerve plexuses. The cervical plexus, formed from the ventral rami of C1 to C5. The brachial plexus, formed from the ventral rami of C5 to T1. The lumbar plexus, formed from the ventral rami of T12 to L4. And the sacral plexus, formed from the ventral rami of L4 to S4. The cervical plexus, C1 to C5, innervates the muscles of the neck and the diaphragm. The brachial plexus, C5 to T1, innervates the muscles of the pectoral girdle and upper limbs. The lumbosacral plexus, T12 to S4, innervates the muscles of the pelvic girdle and lower limbs. And we're going to break it down. All right, so the cervical plexus. The cervical plexus, C1 to C5, is found anterior to the trapezius and deep to the sternocleidomastoid muscle, to give you an idea where they are in your neck, where it is in your neck. Okay. The cervical plexus receives sensory input from the head, neck, shoulders, and diaphragm. It sends motor commands to the 5 larynx muscles, which we don't learn, the rhomboid and serratus anterior muscles, and the diaphragm. An interesting nerve that extends from the cervical plexus is the phrenic nerve. The phrenic nerve is composed of axons from the ventral rami of C4 mixed with axons from C3 and C5. The phrenic nerve receives sensory information from and sends motor commands to the diaphragm. The phrenic nerve is the only motor innervation to the diaphragm. And you can say a little jingle, C3, 4, 5, keep the diaphragm alive, like that, if that helps. All right, so that was the cervical plexus, and the one nerve that you want to learn from it in detail, the phrenic. There are many other nerves, but you don't have to learn those. Just the phrenic nerve. All right, now the brachial plexus. Now the brachial plexus is the one plexus that's often taught in a lot of depth to beginning students, nursing students, medical students, that kind of thing. So let's start to get familiar with the brachial plexus. So the brachial plexus is formed by the ventral rami of spinal nerves C5 to T1. It passes between the middle and anterior scalene muscles in the neck. From there, the brachial plexus passes posterior to the clavicle and then it enters the axillary area. The brachial plexus is composed of complex interwoven pathways. The rami or roots lead to trunks, lead to divisions, lead to cords, lead to nerves. Now, a little note on the use of roots for rami. I don't get it. Just leave it rami because we already have dorsal and ventral roots near the spinal cord, which are not these ventral rami. So I just like to say rami, even though sometimes you will see roots. All right. The brachial plexus forms five nerves: the musculocutaneous nerve, the axillary nerve, the median nerve, the radial nerve, and the ulnar nerve. The brachial plexus receives sensory input from the skin of the scapula, shoulder, and upper limb. The brachial plexus provides motor innervation to the muscles of the pectoral girdle and upper limbs. The trapezius is an exception. It has motor innervation by cranial nerve 11. But other than that, if you look at this picture, which we learned all of these muscles that positioned the pectoral girdle, they did all sorts of actions on the arm, the forearm and hand, the hand and fingers. All of these are innervated by the brachial plexus, with the exception of the trapezius. A lot of work here, and we will begin our study of the brachial plexus nerves with the musculocutaneous nerve because it is the most superior nerve, so we'll just use that first. The musculocutaneous nerve carries sensory information from the lateral forearm. It sends motor commands to the bicep brachii, brachialis, and coracobrachialis muscles, all the anterior muscles in the upper arm. Well, not all of them, but a lot of them. The axillary nerve, C5 through C6, carries sensory information from the skin of the shoulder. It sends motor commands to the deltoid and teres minor muscles. And note that I'm giving you, going back to the slide for musculocutaneous nerve, because I forgot to tell you, I'm giving you a little map that shows you C5, C6, C7 joined together. They go through some pathways, and then they end up forming the musculocutaneous nerve. Also, in this slide, there is a picture of the musculocutaneous nerve and the muscles that it is innervating to help you to see why it would be in a good position to innervate those muscles. Okay, so now back to the axillary muscle, which carries sensory information from the skin of the shoulder and sends motor commands to the deltoid and teres minor muscles. We see here our little map shows C5 and C6, and then things get a little crazy. There's a passage from the superior part of the plexus to the middle part and then out to the axillary nerve. And here's a picture showing you the axillary nerve, which is yellow, but then splits into green and blue. Okay, and the blue is showing you that it carries sensory information, and the blue is carrying motor commands and is innervating the deltoid, which we expected it to do. The median nerve, C6 to T1, carries sensory information from the skin of the anterolateral hand. It sends motor commands to the pronator teres and pronator quadratus, and the flexor carpi radialis, palmaris longus, and flexors of the fingers. Just for a little review, carpal tunnel syndrome is due to swelling and inflammation of the tendons in the carpal tunnel, leading to compression of the median nerve. It causes pain, numbness, and weakness in the distribution of the median nerve. Okay, the radial nerve, C5 to T1, carries sensory information from the posterior upper limb. It sends motor commands to the tricep brachii, anconeus, brachioradialis, extensor carpi radialis, and extensor carpi ulnaris, and extensors of the fingers. So it does a lot. And finally, the ulnar nerve, C8 to T1, carries sensory information from the medial hand. It sends motor commands to the flexor carpi ulnaris and other flexors of the wrist and fingers. And here on the map, you can follow its progress and from C8T1 to the ulnar nerve. And here in the picture, we're seeing the course of the ulnar nerve and how it ends up innervating the flexor carpi ulnaris and other flexors of the wrist and fingers. Okay, here's a picture of the brachial plexus from Martini's that you can enjoy. Here's a table from Martini's, a sort of reference table that they've made here for you. Put it in. Okay, now the lumbosacral plexus. The lumbosacral plexus is formed by the ventral rami of the spinal nerves T12 to S4. The lumbar plexus is formed from spinal nerves T12 to L4. The sacral plexus is formed from spinal nerves L4 to S4. Together, they innervate several axial skeletal muscles and all of the appendicular skeletal muscles of the pelvic girdle and lower leg. And here's a picture of the big old lumbar plexus and the big old sacral plexus for you to look at if you would like. And here's a picture from our prior lectures with some special coding. If it's in blue, it means it's not innervated by the lumbosacral plexus. And then there are some L's that stand for lumbar plexus and some S's that stand for sacral plexus. And you can do with that what you will. So now the lumbar plexus and the sacral plexus are the last two little sections. The lumbar plexus formed from the ventral rami of spinal nerves T12 to L4 is found within the psoas major muscle. It branches to the lateral abdominal wall and extends inferiorly to the pelvic girdle and lower limbs. The lumbar plexus carries sensory information from the inferior abdomen, the buttocks, the external genitalia, the thighs, the medial leg, and the medial foot. The lumbar plexus provides motor innervation to the transverse abdominis, internal and external obliques, quadratus lumborum, iliopsoas group, obturator externus, adductor group, quadriceps, and sartorius. The femoral nerve, L2 to L4, is an important lumbar plexus nerve. It descends inferiorly under the inguinal ligament, lateral to the large femoral artery and vein. And here we see the femoral nerve in yellow. We see that it's lateral to the large femoral artery and vein. So that's great. The femoral nerve carries sensory information from the skin of the anteromedial thigh and the medial leg and foot. It sends commands to the iliopsoas, quadriceps, sartorius, and pectinus muscles. Okay. The femoral nerve carries sensory information from the skin of the anteromedial thigh and medial leg and foot. It sends motor commands to the iliopsoas, quadriceps, sartorius, and pectineus muscles. And I apologize for that little break in the flow there. Okay, so onward to the sacral plexus, and we are done. The sacral plexus is formed from the ventral rami of spinal nerves L4 to S4. Part of the ventral rami of L4 and L5 form a lumbosacral trunk that joins the sacral plexus. The sacral plexus is found on the surface of the posterior wall of the pelvis. The sacral plexus carries sensory information from the posterior thigh, the external genitalia, the perineum, or the area between the thighs, the leg, and the foot. It sends motor commands to the gluteal group, lateral rotator group, except the obturator externus, the adductor magnus, the hamstrings, the popliteus, plantar and dorsiflexors of the ankle, flexors and extensors of the toes, the urogenital diaphragm muscles, and the external urinary and anal sphincters. Wow, does a lot. The sciatic nerve, L4 to S3, is an important sacral plexus nerve. It's the largest nerve in the body. It leaves the pelvis and passes under the piriformis muscle. The sciatic nerve carries sensory impulses from the lateral leg and from the foot. It sends motor commands to the hamstrings and part of the adductor magnus. The sciatic nerve then courses down the posterior thigh and branches into the tibial and fibular nerve. The tibial nerve acts on muscles found in the posterior leg, the gastrocnemius, soleus, popliteus, tibialis posterior, and flexors of the toe joints. The fibular nerve acts on muscles found in the anterior and lateral leg, the short head of the bicep femoris, the tibialis anterior, the fibularis longus, and extensors of the toe joints. Clinical correlation. The sciatic nerve is avoided when giving gluteal injections by injecting into the upper lateral quadrant of the gluteal area. Okay, clinical correlation. Sciatic nerve difficulties. Injury to the sciatic nerve can cause sciatica. Sciatica is pain, numbness, and/or weakness in the lower back, buttock, thigh, or leg. Sciatica is very common. About 40% of people have some form of it at some point in their lifetime. Sciatica can be caused by inflammation of the piriformis muscle. It can be caused by bulging of an intervertebral disc and pinching of a spinal nerve that is part of the sacral plexus. Sciatica can be caused by bony overgrowth in the vertebral canal or intervertebral foramen that can compress the spinal nerve that is contributing to the sacral plexus that is forming the sciatic nerve. And on that note, that's it. Stop share. Very good. All right then. Very good. See you soon.